Hi everybody, I am Dr. Katie Schmidt. I am the physical therapist over at Hollings Cancer Center. One of my favorite things to work on is chemotherapy induced peripheral neuropathy. One of the best ways to change your neuropathy is to rub your feet. This is my favorite thing to give out for homework, but it can be a little bit confusing. So let's do it together. This is the neuropathy massage. This is kind of a weird video angle, but I hope that you can see my foot. This is my right foot. We'll do the right foot and the left foot so that you can follow along. Grab whatever favorite lotion that you like. In the clinic, I use Vaseline. You can use anything that you like. This was a gift from a patient, so I'm gonna use this one. I like to put a little bit of lotion, probably a little bit more than that, right on the shin so that I can go back to it, kind of like a little thing of paint. The first thing you're going to start, you're going to take the lotion, grab the heel, and you're just squeezing it. There's a fat pad down there. You're trying to get it to just relax. Then you're going to take some lotion, put it on the arch of the foot, and I like to put my hands on the top, my thumbs on the bottom, and press through. So it's thumb over thumb, nice and slow. You're just pressing through the bottom of that foot. What I'm looking for are any little trigger points, any little speed bumps, spots of tenderness. If I find one, I'm going to hang out on it. Then I'm going to go to the ball of the foot and kind of spread the toes apart as I'm pushing through. Really get up into those toes. Then I'm going to go to the top of the foot. I think in between the toes is where you make the biggest difference with neuropathy, but I don't have any proof. So you're going to take the lotion. I'm going to put it on the top of the foot. You're going to put your finger in between the toe. I like to turn mine sideways. And then you press through. I'm trying to get all the way through in the middle of those big, long bones of the foot. And I'm feeling, again, for any of those trigger points. In here, this area is very sensitive. It's not used to being touched. It's kind of the spot where if you find one of those trigger points, you can get someone to tell you all their secrets. I'm working down in between the second and third toe, the third and the fourth. I'm going to go back to the second and third. I found one of those good trigger points. I'm going to hold on to it. You can put your other fingers on top, just giving it some pressure. And we're holding it here for 30 to 90 seconds to get the muscle to relax. So the brain knows, hey, I'm okay. I can let go. I don't have to be numb. I don't have to be tingly. I don't have to be burny. We're going to go through and on to the last one. Then we're going to go up to the toes, kind of massaging out the toes. And you're going to take each toe and you're going to pop it. It might pop. It might not. Either way is good. You're just opening up the joint. Then we're going to do the same thing to the foot. I'm going to hold these 4 bones. I'm going to take the toe and I'm holding on to the joint of the toe and I'm going to wiggle it. And I'm trying to get that bone to just move really well. And then I'm going to go to the second and third toe, wiggle those, the third and the fourth, and the fourth and the fifth, and wiggle those. Just working my way across. If you feel anywhere that's clicky or if it's sticking, spend a little extra time there. Sorry, I have to keep resetting my computer. Now you're just going to go back to any area that needed a little bit extra love. Take your lotion for the other side and push back up towards you. You don't want any swelling to hang out in that foot. You want it to leave and go up towards you. Perfect. Okay. Now on to the second foot. Take the lotion, put it near the ankle, start at the heel, grab the heel, and you're just massaging. Take some lotion on the bottom of the foot. Thumbs are on the bottom, fingers are on the top, and I'm pressing through. You want to be very careful and very nice to your fingers while you do this. Sometimes you might have neuropathy in your hand, and it might be difficult to do this. You can take your knuckle, and you can push through the foot that way. You can take a ball and roll the foot, and you can also talk a loved one into doing this for you. Go up to the ball of the foot, spreading the toes, spreading the foot, and up into the toes. Okay. Now we're going to go to the top of the foot in those little bone areas. So I'm kind of pulling back towards me. If you are doing this for someone, you might be sitting and pushing up for them. So I'm going to take my thumb, put it in between the bones of those toes, and pull back. And I've got thumb over thumb, just trying to give myself some extra pressure. Working in between all those bones. Okay. Going up to the toes, popping them one at a time. They might pop, they might not. Either way is fine. Then I'm going to jiggle the foot. So I'm holding the big bone of the toe, holding the other four, wiggling 1 on 2. Hold 2, wiggle 2 on 3. Hold 3, wiggle 3 on 4. And hold 4, wiggle 4 on 5. Now bringing everything back towards me, trying to make sure there's no swelling hanging out in the foot, especially around the ankle joint. And my feet are nice and happy. So I wanted to explain a little bit more of where we're pressing through that neuropathy massage. And I've got my friend here. He's gonna let me borrow his leg. So you've got the foot, and you've got the heel, you've got the midfoot, you've got the forefoot, you've got the toes. When we start with the heel, and we're just kind of rubbing through there, and then we work through the arch of the foot, we work through the ball of the foot, and then we get into the front. And so that is in between these long bones of the toes. And you can see there's the mid bones, and then there's the toes, and then this is what we're pressing through. So we're actually trying to spread these bones apart as we press through here. That's why I like to line my finger up right where the toes separate, turn them, and kind of push through. And I can really find any of the trigger points, anything that's sort of hiding out in there that's causing tension through the foot. Then, when you go to wiggle the bones of the toe, you're grabbing this big bone right here, and you're wiggling from here. You're not, this little piggy went to marketing, the top of the foot. You're grabbing the big bone of the foot and wiggling 1 on 2, 2 on 3, 3 on 4, and 4 on 5. That way you're opening up the joints, and you're opening up all these little muscles that are holding on to the nerve endings, creating that tension, creating some of that neuropathy. There's a lot of layers of muscles in your feet, so you really want to take your time and give them some love. Hopefully your leg doesn't move like that, and hopefully that makes a lot more sense now.